Thanks for joining me at SDTS, next big thing here in Houston. I appreciate it, and I'm excited to share the RevMedica story with everybody. So you feel like you've got this open architecture in this stapling platform that allows you to constantly sort of top grade it, refine it, add new features, remove features because of the modularity of it?
Yeah, because of the modularity, because of the way that we pack in the cost into a reusable nature, we don't have to all of a sudden start wrapping dollar bills around each device. We amortize the costs out over procedures. So when I think of a sensor or something that may kill a product right away, if it's single use, it doesn't have to. We could do it in a way that we communicate with electronics within the reusable aspect of the device to really reduce the costs overall of the system while still giving the user added benefits.
So your intelligence or advisement is sitting in the reusable part.
Correct.
And then, but it gets translated from the single-use stapling part
Yes.
for the user.
Yep. Sterile shrouded. So that's something that current systems are developing now. It's been in orthopedics for years, the aseptic transfer nature of these devices. Medtronic started to do it with their handhelds, and we are doing the same thing. And what that allows us to do is it allows us to have a sterile device with a reusable nature. We eliminate all the sterilization back-end processing. So just from a system level processing perspective, it's much more streamlined.
So I want to get this right. So when you went to Avitas, you had this stapler concept in your mind. But then you started to see opportunities that really were there to obviously help the surgeon and patient. But then you looked at workflow. And even though it was the orthopedic market, the untangling of the workflow to see where the opportunity was, especially for the sales rep. And I love hearing that, if I got that right, because they are such a critical part of the ecosystem.
Absolutely.
Right? The whole setup.
Everything, yeah. And there's a disconnect in big corporate between your engineering teams and your sales reps. Like, that's clearly known. One of the benefits of being in our environment and our world is everybody's talking. Everybody's hanging out. Everybody has to translate whatever their needs are to each other. So a great aspect, as you know, in working with a startup is, one, we start with a blank canvas. So that was awesome to begin with. And we said, like that aspect of that device, like that aspect of that device, like that aspect, let's use those. Don't like that, we're not gonna use that. Don't like that, we're not gonna use that. Bring it all together to have a novel device within itself. Although the parts may not be individually novel, the system itself becomes novel. So that's what allows us to take all these stakeholders and implement their wants and needs so that it's effective across the board.
It's really interesting. I've been at this for 30 years, and I've rarely heard, I'm trying to recall, that we designed this with the salesperson in mind as well.
You have to, though. I mean, I don't know how you don't. They're going to be your point of contact for most things. As much as we work with the users on the engineering side in a startup world, that's only temporarily. You know, the life cycle of the product is 10 years post after launch. So if you're not going to take into consideration what one entire part of your company wants and needs, then you're missing something. And maybe the messaging, and maybe why that's a novel thought, is because it's always what the users want, what the users want, what the users want. But part of what the users want and part of delivering that comes from the sales staff as well. So you have to take them in consideration, at least from my perspective, living the nightmares of not taking it into consideration to begin with.
Did you have any influence from when you were in the ortho company after you left stapling ortho, and then there was no more budget in that startup for new products, and then you went out into the field? You now looked at things differently as a designer?
Oh yeah, Yeah. I mean, every time you get a different experience, it adds in your own intelligence. That's why, young me and Medtronic, they always preach jump around from function to function, you'll move up the organization better. They have that whole methodology of individual development. And as a junior level guy, with a hard head, it doesn't make sense. There's no way until you live it yourself and you say, oh, now I get it. I would have never had that aspect. I would have never had that thought. I would have never had that consideration to do battery removal and charging and footprint in a core stack if I didn't have to run through a core stack and look for products. You don't have that appreciation unless you're living that and you're about to miss a case. That impact, those memories, they drive a lot of decisions.
If you're paying attention.
Yeah.
So a stapling device.
Yes.
Right? So when people hear stapling device, they're like, why are you going to pick a fight in a market where you've got two giants going back to the old days, right? I was there when it was Senko before it was Ethicon.
Yeah.
And then I went back to the Leon days when it was US Surgical. And then obviously, now it's J&J and Medtronic. What is so unique about this for the viewers who might not be aware of RevMedica and maybe the form factor and the benefit to the user as well as the benefit to others in the ecosystem, which I like?
So it is definitely going to be a challenge. The team internally, when we started looking at the market and what it was doing, we saw a lot of R&D development dollars going into the full robotic systems and the minor iterative R&D changes of current hand instruments. So what we thought would be the most impact to future technologies was in advanced analytics in a handheld. So just from a strategy perspective, let's face it, we weren't going to make a robotic system. We had great ideas of how to manage tissue, how to give feedback to surgeons, but we weren't going to do a 5-armed, huge capital robotic system. Like, it wasn't going to be the case. And all the big companies were focusing all their R&D dollars on it. So why would us, as an upstart, come into the market and say, oh, I have a robotic system and I'm going to sell it against Intuitive? It's crazy. Crazier than what we're trying to do. So we thought that there was a huge gap in the intersection between the full robotic systems and the hand instruments. And what RevMedica wants to do is we want to attack that center portion of the market, give the users that love their traditional laparoscopy all the advanced analytics that's in a robot, and that's what we're aiming to do.
It's really interesting because what I've seen is you've got the incredibly complex system of Intuitive, appropriately so, and that's a compliment. But in a lot of cases, you lose, or all the cases, you lose access to your favorite stapler, right? And then now you've seen sort of the market pull back with platforms like Moon and Distal Motion, which allow the surgeon, especially in distal motion, to use their favorite energy device, their favorite stapler, and remain in the sterile field as part of, let me use robotics on demand, but then let me keep my hands in the patient. So this looks like it might find the spot in that category.
Yeah, we are positioning ourselves to be in that ancillary, here's a top of the line guidance device that has state-of-the-art technology and some technology you've never seen before, and we could operate with all these systems, no issue. Additionally to that, because we started the company off this single robotic arm, and this is a very powerful message, we have all of the core IP that the company was founded on is translatable to robotic arms. So to do the work, to drive the stapler, the distal end of the device can be, frankly, just slapped on the end of a robot if need be. If we look at like a CMR or different companies that have 5 robotic arms and they want the technology that we're delivering. The embedded algorithms, the certain sensing technologies that we're developing, it changes a little bit, but from a fundamental nature of how we're setting up and training the systems, it should be the same and it will transfer the same. So we're positioning ourselves to not only fill the gap of bedside or stay sterile, but also to take the technology and transfer it to full robotic systems as well.
You mentioned something about removing the need for sterilization. And with these changing centers of care right now, moving now more towards ASCs, sort of outpatient surgery with the hospitals, trying to compete with the ASCs. What does that mean to those where you've got this scattered footprint now? You've got the logistics of delivering, you've got the logistics of needing square footage in-house for sterilization capabilities or not. So that's going to change product mix.
Yeah. So, like I said earlier, operating on a blank canvas and really optimizing the system to what we wanted it to do gave us the ability to say we want to have low impact to the healthcare system that we're entering and also the environment. Tom had issues when he was at his previous life in different types of sterilization methodologies in terms of autoclaving, et cetera, of devices in the soft tissue world. I had issues of missing cases because I'm waiting on an autoclave. We both had our own pain points, and we knew there was pain points in the market. So when we positioned this system, we wanted to have minimal impact as possible so that we could be as flexible as possible for market entry. Minimal footprint from a charging dock, literally takes a 110 outlet, that's it. It's gonna be the same exact storage space as all your current handheld devices in terms of shelf cartons. Gonna be no real additional waste, almost no lithium ion waste, which is huge when we talk about competing against other handhelds. So when you look at us holistically across the spectrum of use, we have a minimal footprint and are able to be easily adopted into different care centers because of it.
It's interesting, there's a conversation coming out right now in Congress about ETO and sterilization. And I know AdvaMed and Scott Whitaker are staying on top of that to make sure there's not a terrible impact on the market. And then on the waste side of things, the single use, I think I read a stat that if you took the healthcare system and made it a country, it would be the 5th most offensive developer of waste in the world as a country. And so you think about that, there's some consequences with single use, and reducing that is critical, I think.
Absolutely. Tom, my co-founder, I'll keep mentioning him because we're aligned in a lot of aspects, as we should be, because we're effectively married at this point. But we, from the onset, said we never agreed with the single use. It's necessary in certain cases, absolutely, but where can we cut out all this waste? We shouldn't be throwing out PCB boards every time. We shouldn't be throwing out DC motors every case. We need to reuse that stuff. Like, it's crazy. And it just, when you look at even just the macroeconomics, like you said, just the macroeconomics of where the world's moving, why are we going to be blind to it in medtech? We need to be sensitive to where the world's going and ensure that we're designing our devices to fit that mold.
Yeah, economically as well as environmentally. And I think those are really two things that you can check those boxes without being a loser in either of them.
Yeah, and don't get me wrong, I'm not saying we're going to net zero. Unfortunately, that's not the case. I would love to say we're 1% for the planet and we're going to net zero. But we're at least one step closer and better than others.
Well, I'd love the honesty on that, because the net zero is not an attainable.
Yeah, exactly.
In any category. So
Yeah.
So I appreciate the honesty on that as well, but the good intention, right?
Yeah.
So what does it look like? Take me down the timeline as we finish up here. What's the timeline on RevMedica, FDA, maybe go to market, et cetera?
So as I mentioned, we secured funding about a year ago now, which is going to be instrumental in our development of this product. We have been in the process of scaling our internal team. Engineering team at this point is set. Bunch of people that we've worked with in the past that's really promising, all experience on like devices at places we worked with in the past. individuals that we feel really strongly about in terms of their capabilities, their expertise, what they've achieved in the past. So building that team is going to be instrumental in us releasing within the next year to the market. As we get closer to commercial release, we're building the commercial side, at least from an executive perspective, and we're actively recruiting currently. One of the things, as we talked about, that I feel is a need, and our board feels very strongly about, is ensuring we don't have a commercial miss and ensuring that we're taking all commercial stakeholders and considering what their needs are and bringing on a person that could really spearhead that, take the burden off Tom and myself from a day-to-day perspective to ensure that those touch points are being maintained is going to be critical. So exciting time to be at RevMedica. A lot of fireworks. It's like every day something new is happening. Every day we have a different interview for a different role. We're going to be doing a nice team building event now that the whole, at least core team in our Connecticut offices is in place. Nice team building event next week, so check back with me in 2 weeks and I'll let you know where everybody has their opinions and how we're kind of guiding the vision and the future of the company in different ways other than just Tom and myself. But really exciting time.
Well, it's great your location. For those that don't know, you're in Connecticut and not far from the old stomping grounds where US Surgical was sort of born and grown. And so the suppliers, the contractors, the partners up there, the relationships are incredibly critical to making a product in that category, let's say.
Joe, I don't think I could speak highly enough of our supply base. We would not be where we are today without them. Guys and girls that have made parts that are like parts they make for others, that are critical components, and there's a lot of different little nuances and intricacies. If we didn't have some of these partners, we wouldn't be here. I mean, it's so easy and refreshing for me to just have a concept and array or just like a solid model, let's say, not to get too much into the weeds.
Yeah.
And send it over to them and be like, guys, I need you to make it. And can I get a favor in 2 weeks? And they're like, oh yeah, we've done this before. And
Right.
okay, 3 weeks, you know? So it's been instrumental to our success and will be instrumental to our future success to make sure that we maintain those relationships.
Yeah, and then finally, is this a platform technology or is it a single product?
So platform technology, first product that we're targeting is going to be the 60 millimeter laparoscopic stapler. We're going to build out the ancillary sizes for all different specialties in the near term. Our regulatory classification gives us a general indication, so good for cardiothoracic, general, bariatric, any soft tissue indications where you're stapling, which is good for us because it doesn't give us just one point of sale or one use case, gives us multiple as markets shift and as we see different macroeconomics coming into play here. The control module itself and the whole reuse nature, the advanced analytics, it's transferable to every hand instrument. So when we start thinking about system and where we want to go and wireless connectivity, everything's been hypothesized or thought of. It's what makes sense for the users. But this method of how we're encapsulating everything and reusing it and amortizing out the costs so that we could give the benefits to the user without charging them a lot of money, that's transferable across the board. So sky's really the limit, and we'll let the market dictate that. That's what I'm continuously saying. So to long-windedly answer your question, it is a platform. We'll just let the market dictate where we bring it.
Very cool. Well, congratulations on the sort of progress you've made so far to date.
Thank you.
You and Tom and the team.
Yeah.
And it'll be fun to watch.
Yeah, thanks.
Good to have
It's been fun. Thanks for having me.
I'm Joe Mullings from SDTS, the next big thing in Houston. Be well.